So, I want to start off by saying we're at the 258th day and 8 months into it, in our first case back on March 12th, week 38. But sadly, last night, we lost two more Albany County residents. There are a woman in her 60s and a man in his 70s. Neither are associated with a nursing home, and my condolences and prayers go out to the family. And that brings our total now to 150 since the outbreak began. Difficult time, especially right before the holiday, right before Thanksgiving, to lose two people. And 60s and 70s, not old people, just to bring that in to the right point of view, because certain people think, well, they're 60, they're 70, they're 80, or did they have underlying health issues? Doesn't matter. Someone lost a loved one. And again, to the two families, my heart breaks for you to have to go through this at this time, and that we're here for you. As of today, we have now 5,279 positive cases of the coronavirus in Albany County to date. 2,452 people are currently under mandatory quarantine. We have an increase today of 109 new positive cases. We have now 1,749 new positive cases since November 1st. That's more than 33% of our total positive cases since the outbreak began in the month alone. 1/3 since the beginning. So of the new positive cases, we know 19 have had close contact to positive cases. One was reported traveling out of state. 5 are healthcare workers, and 84 don't have a clear source of infection at this time. As of today, 21,570 people have now completed quarantine. 4,361 tested positive for the virus. We have a recovery of 41 recoveries since yesterday. Currently, right now, there's 41 people currently in the hospital, in 0 new hospitalizations overnight, which is good. With a hospitalization rate of 0.77% of those who've tested positive, yesterday that rate was at 0.82%. When you look at the total hospitalization since November 1st, we've had 92 residents go into the hospital because of COVID-19. It was a question, and it was a great question that I got from, I think it was someone from Channel 13, Dan, I think it was, but kept talking about what was the number of people going in versus going out, because it is kind of almost like a revolving door, and it was a great question. And it's alarming when you had 92 residents going into the hospital because of COVID-19. That's nearly 20% of all hospitalizations since March 12th. 10 patients are currently in the ICU. Yesterday, that number was 12. Over the last 5 days, there's been an average of 93 new positive cases each day. Yesterday, it was 88.6. Looking at our percent positive rate, over the 7-day rolling average was at 3% as November 23rd. That's now the 4th day in a row that we've had a positive average of over 3% or above. 10 days in a row qualifies us to go into the yellow microgrid zone. Through the state, we'll likely look at individual locations, zip codes, or neighborhoods when establishing these zones, which comes down from the state, has nothing to do with us. State DOH decides what zones, if it's a full zip code or if it's certain neighborhoods, and how it breaks up. So if it does happen and we continue in this trend, they will notify us of what that zone will look like. A yellow zone means 50% capacity at houses of worship, 25 persons maximum from non-residential gatherings, 4 persons limited for indoor dining, and requirement to test 20% of the school population. Either way, we need to do more to bring these rates down to avoid this. We encourage people, even if you have signs and symptoms, to get tested. If you don't have signs and symptoms, please go out and get tested if you think you're exposed in the wrong area, because yes, we are having more testing available, more people are getting tested, but we're getting more positives coming back. Speaking of these cluster zones, the governor and state department of health announced yesterday they would be loosening the school restrictions on K through 8 classrooms in orange and red zones. These new rules will allow schools to reopen within 5 days once the specific testing requirements are met, which is good news. So, because we know the infection rate in schools are actually very, very low. And again, we're in this together. And there's a lot of parents out there that are single parents, or both parents are working, and they need their kids in school because they need to get to their job. They're essential workers. And we need people to do the right thing so we can keep this rate down. I know it's tough. And Dr. Whalen and I say this all the time. We're in this together. We have to continue to wear our mask right. Yes, we are pleading to you. We're saying, please help us get through it. These next 2 months, the way these numbers are coming in, it's gonna get worse before it gets better. It's gonna get worse before it gets better. And since October 31st, it's been this way. And we see what happened on Halloween when we left our guard down. Now we have Thanksgiving tomorrow, which is going to be another major holiday where people are just fed up. They got COVID-19 fatigue. They don't want to do it anymore. And I'm pleading with you, please do the right thing. I don't want to close these businesses down. We got a major shopping holiday coming up and everything else. We need your help. We need your help to get through this. And to the people doing the right thing, thank you. And I do want to clarify, we did have someone call our office this morning, and I will get back to you after this. That was very angry. I want to say this. Dr. Whalen made a statement, and I've said it many times too. Just because you get tested, we're saying, yes, we want you to get tested, but we're saying also, and please, Liza, jump in if I'm saying this wrong. If you get tested, we're not saying that you can't walk out that door and get infected. We're just saying you got to be careful. Just because you got a negative, positive, which is good, doesn't mean you can't catch it an hour later.
It's before.
Or before, yes. So please, she was very upset, and it's not what we're saying. We want you to go out and get tested. You still got to be careful. You still have to be careful. It doesn't mean, and I know I say this, you got an S on your chest because, hey, I'm negative, so I can go out and do whatever I want to do. No, you still have to stay 6 feet apart, put your mask on, cough into your arm, clean your hands, and do the right thing, and we'll get through this. So please, I know at times our audio is bad. I know sometimes you don't hear the full message. But I can assure you, we do want you to get tested, but you still have to do the right thing after you get tested and before you get tested. So our actions will determine how many will be infected over the course of the next couple of weeks. And, it depends on how we act going forward, whether or not more people are going to die from this, or more people are going to get sick, or more people are going to be in the hospital. So please do the right thing tomorrow. I want to say enjoy your holiday, enjoy Thanksgiving, but please do the right thing. We're asking people to avoid traveling, avoid clusters of coming together in big family groups, and we are seeing more people get tested in the last couple of days. But they're getting tested for the reason that if they think they're positive, they can sit together with their family and loved ones, and they're good because they're all negative, and Dr. Whalen can hash on that better than I can when I turn it over. Please, doesn't mean that you can just go to mom and dad's house or your sister and brothers because you got a negative test. So we need you to do the right thing as we move forward. Testing is one of the best tools we have to combat this virus, even if it's just a cough or a sneeze, or even if you don't have a symptom. But we want you to go out and get tested, even if you're in a crowded room at some point, or you're out shopping or you feel uncomfortable. Please go out and get tested. It's free. I want to remind residents to go to our new map feature on Albany County website. You can make it easier than ever before to locate different testing sites. From UAlbany, Whitney Young, Price Chopper, Walgreens, plenty of others you can choose from. And again, it gives you the wait times. It sets it up. I know some of them are backed up because it's the holiday. And the alarming factor is I wish they were listening to Dr. Whalen and I and they were getting tested to do the right thing. I have a feeling people are getting tested just so they can go to Thanksgiving dinner. That's, I'm glad you're doing it, but again, it doesn't mean you're safe to sit in a room with more than 6 people in a room or 10 people in a room or see mom or dad or your brothers or sisters or your neighbors just because you got a test. So, please just do the right thing and stay home this year and celebrate down the road. But you can log on to the website, check it out, and you can require to make appointments, and we'll set it up for you, whether you want the rapid testing or you want the conventional testing. So again, Albany, you can call 1-888-364-3065. Whitney Young, as always, 518-465-4771. Dr. Whalen.
Thank you. And thank you for letting me know I should clarify those remarks yesterday. First of all, I want to say that, this has been very difficult for everybody for so many reasons. But one of the reasons is that, the public has had to really take a crash course in infectious disease, in virology, in epidemiology, in many things that, are pretty complicated. And this is an example of that. So, after you're exposed to a disease like COVID, there's something called the incubation period. And I think this is something everybody's heard of. You know that the incubation period can be between 2 and 14 days. So what happens during that time? During that time, your body comes into contact with the virus, and it starts to mount an immune response. The immune response takes time to mount, and that's why people don't become symptomatic immediately. And that's why people don't test positive immediately. So that's the concern. You could be exposed and get tested too close after your exposure, which you may not be aware of, and that test may be negative. And in the meantime, while the test is negative, your body is in fact mounting an immune response. So you could develop symptoms and subsequently have a positive test. This is how it goes. We're learning about the time periods, and I wish I could give definitive, well, it takes this person this many days, and if you test on this day, you're fine. If you don't, you can't be guaranteed. There's no guarantees. That is why we talk about the combination of testing and knowing that you in fact did not have any exposures. So that's a kind of quarantine without being placed on quarantine, being on quarantine yourself. So if you limit your exposures to others and you know you have not been in a place where you could have been exposed and you test negative, that can provide you some reassurance. Again, I cannot say ever in healthcare that there are any guarantees. So you can choose your risk. But it's very important that people know that negative test is not a get-out-of-jail-free card. And it's important that people are aware of that so that they can inform their behaviors. Mary, can you put up the Epi Curve, the second slide, that we look at in terms of our disease rate? That one, yeah. So, if we look at this curve and where we currently are, and we look back to October 30th, October 31st, Halloween, and we talked at that time about exponential spread. So what does exponential spread mean? It means if you don't control the amount of people that you're in contact with, generally people will spread it to 2 or 4 other people. They could be household contacts, they could be people you work with, they could be people that you interact with socially. But without these controlling measures of limiting our exposures, wearing masks, frequent hand washing, etc., then we start to see this number go up. We're higher now than we ever were. Remember back in April when we saw that high number and said, well, this is the worst of it? It's not. And what I unfortunately need to tell you today is the numbers that we are currently seeing could be the start of our next exponential growth curve if we don't appropriately adapt mechanisms for control. And this is entirely dependent upon you. So our numbers could be significantly higher coming into Christmas. And if they continue on the current trend, they will be significantly higher. This is not just a concern in Albany County, it's a concern we're seeing across the country. And this is why we continue to hammer home this message of individual responsibility. It is a serious disease. It can cause hospitalizations and deaths, and we want to protect you and your loved ones. I heard something yesterday that I thought was such a good message for Thanksgiving, and it is to protect those you are thankful for. And that is the real meaning of Thanksgiving, is to protect those that you're thankful for. So this year involves a little bit of sacrifice for that. And again, I know Dan and I have mentioned that we both will be making individual sacrifices this year for Thanksgiving. I have one child who's not coming home for Thanksgiving. This will be a first for me, and it's hard not to be with her. I will not be able to sit down at the table with my own parents, who I'm very close to, and who I normally celebrate with, and my brother and sister and their families. So these are sacrifices that we've all agreed are important to make so that next year's Thanksgiving can be that much more meaningful. I wish it could be different. I wish I was giving different advice. I wish that, the trend of the cases going down over the summer had continued, and we would be looking in different directions now. But it's my responsibility to share with you the most up-to-date information. Now, we are hearing a little bit of good news out of the CDC in terms of the quarantine period. There's discussion, although these have not been made formalized guidelines yet, of shortening the time that people who are exposed will need to be quarantined if they get tested on day 7 through 10. We tend to be more conservative in New York State, so I have not heard any guidance on this from the State Department of Health, and we will, continue to work with them around that. As we've said from day one, this is a novel disease. It has not been around before, so we are learning about it in real time. And as we learn about it, we can make tweaks like this, which hopefully will make things easier for people. But testing is going to remain a crucial part of control, as is isolation and quarantine. If you are reached out to as a case, it is much more important to us that you know who you've been in contact with from 2 days before you became symptomatic to the present than it is for us to know how you got it. Lots of people don't know how they got it. That's okay. We need to know who you've been in contact with so we can protect them and protect others from unknowingly being exposed. Because again, the concern is that people can start to shed virus 2 days before they're symptomatic. And there are a certain proportion of diseases that we're seeing that are from asymptomatic cases. I know it's confusing. It's confusing to us sometimes. And, we are just committed to continuing to learn about this on a daily basis and providing evidence-based information to the public. The recommendations that I provide to you, the advice that we discuss on a daily basis is all evidence-based. It is all what we have learned, comes from what we have learned from other viruses, and comes from what we are learning about COVID-19 as it evolves. And that is the best we can do. Until we are turning the corner and starting to see cases go down, or until we are at the time where we have safe, effective, and widely available vaccine and a good uptake, this is the boat we're in. As Dan says, we're in it together. And, I will reinforce my commitment to continuing to share information with you that is up to date and evidence-based to help you protect yourselves and your families.
Thank you, Liza, as always. And, look, the vaccine's here. It's going to take time to get out. And some of the things that I've learned by reading the different stuff from CDC and other sources and talking to Dr. Whalen is that you look at the flu shot, 40% effectiveness with the flu shot, right? 40%. With this is 90 to 95%. It's unheard of, and all the doctors that have spoke about this said, they're beyond thrilled that it's over a 95% effectiveness with with the vaccine that they're putting out. And you also look at flu season that really starts in October. Our hospitals are freed up because a lot of people aren't in the hospitals with flu. Who knows why? Could be the contribute of people getting their shots and listening to Dr. Whalen and people like her around the community. Or is it wearing a mask that really has helped make the difference? Because in Australia, who's 6 months behind us, they had the lowest case in history. But flu season goes from October to February, so I don't want to be premature in saying that. But the reality is this, is that it's helping us keep beds available at our hospitals. And as Dr. Whalen has said, as this continues on and that continues to spike up, what's alarming to me is to have 92 Albany County residents in and out of the hospital in the last 20-some days, and losing 2 more people today. So we need you to continue to do your work to wear your mask properly, cough into your arm, clean your hands, and stay 6 feet apart. So please help us get through this. We can get through this. The light's at the end of the tunnel, and hopefully, in the fall of 2021, this will be a distant memory for everyone. So please help us get there. Some of the other things that have me concerned: Black Friday is this Friday, obviously after Thanksgiving. We want people to go out, but do it safely. Please avoid the congregating at the malls or shopping places. I know everyone has how many people can come into different shops and different businesses. You got to do it a little bit different this year. Be a little bit more cautious. So please, if you go to Colony Center, Cross Gates, or Stuyvesant Plaza, or wherever, do it right, do it safe, and be smart about it. That deal is going to be there whether or not you get it right away like in the past, versus I know most of them stores have extended the sales and other opportunities. So please take advantage of that and do the right thing. The other thing we're worried, the other big thing is we're trying to help many businesses that to go online with a platform. So you got Cyber Monday on Monday morning, which a lot of our small businesses, our brick and mortar stores here in Albany County, are learning how to put their product online, so people can shop online, and they have ways of pickup where you can come pick it up outside their door. They can get it delivered, but please, look at it that way. Work with them. I want to say Lark Street Business Improvement District is hosting the Lark Street Holiday Market on Saturday, so I encourage you to actually, if you want to go out and eat and take it out. Get it delivered. It's very easy now. And the downtown Albany Bid actually put together a list of ways to shop online on our businesses in the area. And the website is the downtownalbany.org. And you can go on to the website, and it has the COVID-19 little hash mark in there, and you can shop with businesses they got online. And one of the other things is that UAlbany is working with small business. The Small Business Development Center, in a partnership with the University at Albany, is offering a webinar series to local businesses that will allow them to better connect with potential customers online. A lot of our smaller businesses don't have the means. Just like when we talked about the PPE loan and different things, they don't have the tools or in the arsenal to help them compete with the bigger companies. So my hat's off to the University at Albany and the Small Business Development Center. And you can go to www.gotostage.com/channels/SBDC, and you can go on there, and they will help you get your company and look for potential people to keep you in business. So anything that will help you stay afloat, we want to help you with. And again, thank you to UAlbany and everyone else. Above else, please just wear a mask and socially distance when you're out shopping. Do the right thing. Stay safe out there. I also want to say happy Thanksgiving to everyone. I know 2020 has been challenging in so many ways and stressful beyond belief. Trust me. It's been tough on everyone. I see it in my staff. I see it in all my departments that people are it's been a tough year on everyone. So please just remember, we're all in this together and we can get out of this. So I do want to say, in so many ways, thank you to all the people in the county workforce, to all the residents that have been sending nice letters into us via emails and cards that are saying thank you for everything that you're doing. I appreciate it. I'm honored to be your county executive. It's been difficult for all of us. We're learning together. No, I will say this. I am not right all the time. I wish I was. And this is something we've never dealt with. And as we move forward, again, we try to give you up-to-date information. We try to stay on top of everything, and we got to wait to get our guidance sometimes from the state, and other times it's just based in the science of what the problem is and how we can address it in the community and how we continue to operate to go forward. So I do want to say thank you to everyone doing the right thing, because there is a lot of people doing the right thing. I want to give a special shout out to Sherry in Schenectady. You send me the nicest emails all the time. Thank you. We wish we could have you come work here in Albany County, but Sherry, thank you. And to everyone else that's out there, thank you. To everyone just doing their job and making a difference in the community, thank you. Listen, I'm hoping tomorrow we won't have to be here. I'm hoping that tonight we get some good numbers, or a reason not to have to be here tomorrow. So we'll let you know as the day goes on what tomorrow is going to look like. But again, happy Thanksgiving to everyone, and to anyone that needs mental health support. It's still going to be available 7 days a week from 8 a.m. to 5 p.m., 518-269-6634. Our 24-hour sexual assault hotline number, area code 518-447-7716. And again, our great partnership with Pete Gannon with the United Way at 211, New York State hotline number as always. And continue to be safe and be smart out there, and we'll get through this.